Hey folks, my name is Amy Pearlman. I'm a urologist and I specialize in men's health, sexual health, and transgender care.
Hi everyone, my name is Aaron McDonough. I am a co-owner of Towncrest Pharmacy in Iowa City, Solon, and New Hampton, Iowa.
All right, folks, we're going to talk about supplements 101. It's a topic that a lot of healthcare providers don't necessarily discuss during an office visit, but it's a topic that many patients and just people in general want to know more about. And so we are going to tackle that topic right now. Something to keep in mind is your healthcare providers should always be consulted when starting a new supplement regimen to ensure safety. And if you find that your healthcare provider doesn't feel comfortable having these discussions, then that might be reason enough to go seek advice and healthcare from somebody else, someone like Aaron, to talk about supplements and how they can help you. Quality of products vary. And so today we're going to provide recommendations for products that actually work well for a lot of people because they are good quality products, but these are by no means any endorsements.
So what are dietary supplements? They're going to help provide a person with the necessary nutrients that person is either unable to make themselves or get from the food or fluid intake. And we'll kind of importance of how to obtain those different kind of vitamins and minerals today. So what are micronutrient reserves? That's kind of where we're starting at today. And although we might know of our nutrients like vitamin C as strengthening our immune function, it's much more than that as well. We have our B vitamins that convert food to energy and just provide us with the energy that we need on a daily basis to go about our activities. They also detoxify chemicals and medications that we take. They manufacture neurotransmitters, hormones, and other key signaling molecules. They maintain tissue repair and cell regeneration as we are exposed to stressors on a daily basis. And a deficiency of micronutrients can create a total breakdown in the metabolic processes that safeguard our health.
Now, the good news when it comes to nutrients is that by eating a healthy diet or nutrition plan, I don't even like to use the word diet because this is really something we want people to be able to maintain, and not just for weight loss, but for overall health. People can get many of these necessary nutrients from eating a variety of healthy foods. And with each of these examples of micronutrients, we're actually going to give you some examples of what those food options might look like. The less good news is that most American diets lack nutrients that are important to overall health, and things like immune disorders and food sensitivities, highly processed foods will prevent people from consuming enough of these nutrients. In addition, medications that treat common health concerns can lead to drug-induced nutrient deficiency.
Drug-induced nutrient deficiency is a less known thing that's occurring on a daily basis with many people across the entire world. More than 50% of Americans take at least one prescription medication. Many prescription medications that are commonly used on a daily basis, as you can see on this screen, can lead to nutrient deficiencies. And although we can source those nutrients from repletion in our food and our nutrition, it's not always the easiest way to do so. So supplements can help us in that regard as well. As you see on this list, we have statin medications, we have antibiotics, we have NSAIDs, we have so many common medications that people are taking on a daily basis. And sometimes we just think that the side effects that we may have from those medications are something that we can't deal with, but oftentimes it's related to a nutrient deficiency that we can simply replete either through nutrition or supplementation. So supplement labels, we want to talk about how it's easier for you to recognize a high quality supplement. As you see here, we mentioned not all supplements are created equal. And this is important to know because there's a lot on the market. There's a lot online and there's a lot in the pharmacy when you come by to look at different supplements. It's important that we find a highly efficacious supplement. Mainly what you see right there in that quote, efficacy is the power to produce a desired result. Our supplements need to be producing those desired results that we want. So the difference between a good supplement versus a bad supplement. And I wish that we could discuss this as the label, the level of just reading a label and being able to know that this is good because it says it on the label and this is bad because it says it on the label. Sometimes that's easy, but sometimes it's more challenging than that, and we have to really vet the brand. We have to know what brand and who's manufacturing this and what is going into the manufacturing process before it gets to you as the consumer. So a good product, a good brand, a good company is evidence-based. It follows the literature. It reads what's going on in the literature and then it formulates supplements based off of that. They get their raw materials from people that they have good relationships with. They get certificate of analysis when you purchase them or when your healthcare practitioner purchases them, and they use USP grade nutrients and minerals. In addition, they do in-house manufacturing. A lot of other cheaper brands, they might just send it off to another third party to do the manufacturing. That's a sign that it's not a good brand. In addition to that, they test their supplements to make sure that the potency, the purity, the strength, composition, all of that aligns with what they're saying is on the label. If it's important that it's on the label, it should be actually in the supplements as well. And so I always mention it should be purchased through a healthcare practitioner. Supplement industry is very saturated and a lot of people just want to sell to get a couple dollars. Unfortunately, those are typically the brands and companies that don't provide the highest quality product. So working with your healthcare practitioner and finding the best quality supplement for you is the best route to go by. And if a company can say, we're going to give 100% money back guarantee, that should make you feel safe. That should make you feel confident that they are putting out a great product that is going to produce the desired results. Now, on the other end, what makes a bad brand or a bad company? It's kind of the exact opposite. They have false structure function claims, meaning they might have some catchy titles in their names, like testosterone booster, or any other things that you might see online that make it seem really appealing to purchase those products. Unknown source of materials. They don't have good relationships with the people who are creating those raw materials. And oftentimes, they're not even manufacturing it in-house. They're sending it off to a third party to manufacture it. And there's just a lot of different checks and balances that might not actually be checked or balanced because of how many people are getting involved. There's no quality assurance or quality control with the company. Once they get that product from the third party, they ship it out to the consumer and hope that the consumer gets it and that everything's good. But that's not the case most of the time. Another thing is if it's too easy to get it online, if it's too good to be true, then that's probably the case. If you can just purchase it right online and it shows up at your doorstep and you didn't have to talk to a healthcare practitioner, it's probably a product that didn't require a lot of checks and balances. They include mineral oxides, carbonates, and rock salts that can be irritating and very low absorption. And in addition, they're just cheap. And you pay for what you get, and not just in the supplement market, but in everything we do. If it's cheap, you're probably not getting a good quality product because the raw materials are not good. There was no quality assurance, quality control, which costs money. There was no rigorous testing. And that's why the product doesn't have the money back guarantee. They just want you to have the product, pay the money, and then go on your merry way. And there's no relationship with a practitioner involved. And that is the most important part when you're choosing a supplement that's for you.
Aaron, question for you. In terms of knowing the source of raw materials and that certificate of analysis, is that something that's going to be on the supplement bottle that people have access to?
Unfortunately not. And that's something that you'll look at the brand level. And oftentimes it's challenging to even know that from a consumer standpoint. And that's why getting involved with your practitioner. Knowing the word certificate of analysis, if you can ask your practitioner for a certificate of analysis of the product, they should be able to give it to you. And if they can't, that identifies a bad product that they might be carrying. So if you mention these things to your practitioner, they should be able to help you find the right materials that you need to read to assess. So we talked about quality minerals, chelated minerals versus the cheap mineral oxides, carbonates, and salts. So what's the difference there? Why does it matter? So we'll talk about chelated mineral complexes and why they're so good. So chelated mineral complexes, they're higher quality, which therefore means higher cost, but it leads to higher absorption. So it's doing exactly what we want it to do. How does it get absorbed better? It's bound to the amino acids. It has names like magnesium lysate, and that's the good chelate for magnesium. Zinc bisglycinate chelate, that's a chelated version of zinc. Those are highly absorbable, and they're gentle and they're gut friendly. If they're not being absorbed and they're sitting in the small intestine or they're sitting in the stomach, then oftentimes they're leading to GI disturbances and side effects that relate to that. And also in regard to chelated products, they use active absorption, and meaning that it is pulled into the body to be used and picked up by the body and our cells to be used for what we need it to be, whether it's calcium or magnesium or zinc. Just enhances that absorption with active absorption from the gastrointestinal tract, and it just uses it for what we need it to be used for. The cheap oxides, carbonates, and salts, again, it's oftentimes the opposite. They're cheap, therefore it has poor absorption. It's magnesium oxide, zinc oxide, calcium carbonate. Oftentimes you can read that on a label and you see that that's the source of that mineral. Oftentimes they require stomach acid to promote passive diffusion. And if they're not acidic environments, then they're not getting absorbed and they're just sitting in the stomach. And if they make it into the small intestine, they're just sitting in the small intestine and causing those gastrointestinal related side effects like constipation or diarrhea. As you see, calcium carbonate, magnesium oxide, those are commonly seen on those cheap supplements that you might see on a daily basis. And there's a quote that says, if consuming a multivitamin has little effect on improving the body's nutrient balance, there's no reason to ingest it. Let's ingest something that is a high quality, highly absorbed product, and therefore it might cost a little bit more money, but it's doing what we want it to do and producing the desired effect that we're looking for. And so this is just a little graph. Some people learn by images a little bit better. But it shows the magnesium chelate versus a carbonate, a sulfate, or an oxide, a non-chelated version of magnesium, and it just shows the absorption. As we see with the magnesium chelate, there's 8.8 times greater absorption than the oxide, 5.6 times greater than the sulfate, and 2.3 times greater than the magnesium carbonate. These are significant to know that this graph is showing us it's getting absorbed, it's being used, it's picked up by our body to be used for what we need it to be used for. So let's talk a little bit about different minerals, different vitamins, what they're used for, how we can obtain them from our nutrients and our nutrition. So we can start with calcium. The typical recommendation is 1,200 milligrams a day. What does that mean? It doesn't mean go get a calcium supplement that has 1,200 milligrams a day. That means that some of that, and hopefully eventually, majority of that will come from our nutrition, but for the meantime, we might have to supplement. And what does calcium do? We all know that it builds strong bones and tooth health, but it also has other functions like heart health and muscle function and nerve transmission and signaling and hormonal secretion as well. So how do we obtain calcium? We've heard about it from our calcium-containing milks, but what other things are there? There's salmon, there's beans, there's our dark leafy greens, the spinach, kale, and broccoli. Oftentimes those can be challenging to get from the diet, but we can work on strategies to make sure that you can get those eventually. It's something that we need to build as time goes on. So there's supplements while we're learning those strategies that we can take. And here's a good brand, a great quality brand, Orthomolecular. It uses a reacted calcium that provides 4 forms of highly absorbed calcium. Why 4 forms? So that we don't overwhelm the absorption pathway with one form of calcium that's not getting absorbed because it was too much at once. So the calcium increases that skeletal strength and promotes that healthy bone. It also contains vitamin D to obtain 50% of the daily value that you'll need for vitamin D, but it also enhances the absorption of calcium. So let's talk about vitamin D. Typical recommendation is 900 to 1,000 units a day. Again, that's not all from a supplement. We can get that from nutrition. So what's vitamin used? Vitamin D, what kind of functions are we using out of vitamin D? Well, we're using it to enhance that calcium absorption so that we can use that calcium for what we need it to be used for. How do we get vitamin D? We all know that we can get it from the sun. That's a moderate exposure depending on where you're located. Us in the northern hemisphere don't get the best vitamin D source because it's never sunny, unfortunately. How do we get vitamin D from nutrition? Tuna, salmon, foods with added vitamin Ds in it as well. Soy milk would be an example of that.
And what I wanted to add here is there are a lot of foods like cereals that are fortified with things like vitamin D. And so even though they have vitamin D in it, doesn't mean they're necessarily healthy. So we have to still look at those nutrient sources to understand if those foods, irrespective of the vitamins and minerals they contain, whether that food source is in and of itself a healthy option.
Magnesium. Magnesium is a very important mineral because most Americans are deficient in it. What does it do? It's a relaxing mineral. It relaxes muscle contraction. It vasodilates to increase the blood flow in our body. How can we get magnesium? It's from the spinach, it's from those greens, fiber-rich grains as well, and nuts and seeds. So there's the quote. More than 57% of the population does not meet USDA requirements for magnesium in the diet. It's one of the most deficient minerals that we have in our body. Intracellular magnesium is decreased also by excessive alcohol, salt, coffee, and soda intake, and high stress levels. Those are things that, it's hard for us to get away from, drinking coffee and not being stressed. Adequate daily intake of magnesium is critical for numerous proper hydration, stress response, that muscle relaxation, the cardiovascular health when we're dilating our vessels. It helps with the blood pressure. It promotes optimal bone mineral density and also has some blood sugar regulation as well. So how do we supplement with magnesium? Well, first we want to maybe avoid taking our calcium and magnesium supplement at the same time because sometimes they're competing for absorption. So once we separate those out, we do need to identify that non-chelated form of magnesium so that we don't produce those gastrointestinal related side effects and so that we get that highly absorbed version of magnesium. And so reacted magnesium here, another orthomolecular product, preserves the gastrointestinal comfort while maximizing that absorption because it's using multiple forms of magnesium to absorb. That 3 forms of highly absorbed magnesium, it does not overwhelm that single pathway. And so high concentration magnesium is used for cardiovascular support as well. It's dilating those vessels, it's relaxing all of the blood vessels and just has a lot of cardio relaxing effects. B12. B12 is a great vitamin, and the reason being is because it is a cofactor to starting the citric acid cycle, and which creates ATP, which is our energy source. So it's the formation of red blood cells and DNA as well. And it does methylation of homocysteine, which is a bad amino acid, produces or helps with brain and nerve function, metabolizes fats and carbohydrates into energy sources that we need. It synthesizes proteins and regulates energy metabolism through all those different pathways. How do we attain vitamin B12? A lot of times it's in meat, it's in salmon, tuna, eggs, and fortified foods with B12. As we just discussed when we talk about fortified foods, it's important to look at the other aspects of that nutritional label. B12, with it being in meats, oftentimes people who might have meat restricted diets might be deficient in B12, so supplementation may be important for those individuals. So there's B12 supplements. There's an ortho B complex, which has multiple B vitamins in it. Supports that healthy methylation and that carbohydrate metabolism into energy. It supports neurotransmitters. It promotes nervous system, immune and adrenal health as well. And it protects against the stress-induced nutrient deficiency that we have on a daily basis just from daily stressors. So a lot of these products can be obtained in one good high-quality multivitamin. This is the alpha base without iron. There's another product that's very similar that has iron in it for those who are looking for iron sources. But it provides that baseline nutrition for those working on strategies to gain their baseline nutrition from their nutrients or from their nutrition and from their diet choices. It has the antioxidant protection. It builds the metabolic reserve and protects against the deficiencies that we may have and be exposed to, whether that's related to our diet or from medications. And it protects against the stress-induced nutrient depletion, supports the healthy metabolism of those vitamins into energy. So we can talk about BCAAs, or branched chain amino acids, as well. You see these a lot, used a lot in athletes because it promotes the growth of lean muscle mass. It supports the energy levels during exercise, as well as inhibiting the protein breakdown within working muscles. That eventually leads to delayed onset muscle soreness. And so if we reduce or delay that onset of muscle soreness after exercise, it helps with recovery so that we can go on to the next training or exercise that we may have in our week. So how do we obtain BCAAs? There's 3 essential amino acids that are in supplements: leucine, isoleucine, and valine, and our bodies do not make them, and they need to be obtained from either foods or from supplements. In food, we can get them from chicken or turkey, salmon, eggs, tuna, tofu, and peanuts. Some people have those restricted diets, so they might not be able to obtain that from food. So we might have to look into a supplement for those individuals. So there's supplements that are in capsule forms as well as in powder forms, but they comprise of those amino acids that we talked about. They promote the muscle function during exercise as well as recovery in building the lean muscle mass, and they're safe for everyday use as well.
All right, so let's talk about D-aspartic acid, because I get asked this question quite often in my clinic where I specialize in men's health and hormone health. When it comes to D-aspartic acid and its functions, there are actually 2 forms of this amino acid. The other is L-aspartate, and we're going to focus on D-aspartic acid. And it's made by the body and actually found within the brain and reproductive tissues. Now, in general, when it comes to the next few supplements that I'm going to talk about, research is limited regarding the effects of supplementation on testosterone and muscle mass. So I do want to make clear that there is no definitive evidence that supplementation will lead to significant changes in testosterone levels. But in general, when we think about how we're going to help people, help patients, we have to understand how we can hurt them. And once we understand that, then it allows us to be a little creative in terms of how we may help them, as long as we're not hurting them in the process. So in general, when it comes to supplementation with D-aspartic acid, side effects are rare. And so supplementation is generally going to be considered safe. We do recommend not taking high doses of this supplement, meaning like 6 grams a day, because there was a study that looked at people who took this amount a day, and doing so actually resulted in lower testosterone levels because of this negative feedback mechanism on brain signaling when it comes to testosterone and that pathway. So that's where you might hurt yourself, is by taking too much of this supplement. In terms of nutrient sources, there are a variety of ones. As Aaron mentioned, when it comes to a lot of these different nutrient sources, they're all very similar. So if you want to get, the B12 and the vitamin D and the calcium and all the ones that he spoke about, they're really all coming from very similar food sources. So when it comes to D-aspartic acid, the big ones are going to be fish, nuts, seeds, legumes, vegetables, fruits. So really the colors of the rainbow, the fruits and vegetables that when you see them in the grocery store, they don't have to tell us they're healthy. We know that those food items are very healthy and good for us. When it comes to supplementation with D-aspartic acid, the powder form is the preferred method because it does have a higher absorption rate compared to the capsules. And a sample regimen would be 2.6 to 3 grams daily. So again, much lower than that 6 grams a day for 2 weeks. And we do recommend actually cycling off this therapy so the body doesn't become resistant to the supplement. The other one I want to talk about is L-Arginine. And the reason why L-Arginine is important is because it's all part of this nitric oxide pathway. And nitric oxide is important as it relaxes the blood vessels, including the ones that go to the genital tissue, specifically the penis. L-Arginine is an amino acid that's made by the body, and it's converted by the body into nitric oxide, which, as I mentioned, causes vasodilation or opening up of blood vessels. And in general, opened up blood vessels are good for body and for tissue health all over the body. It may also help lower blood pressure and improve erectile function and increase blood flow to muscles in combination with an exercise program. Now, whenever we talk about relaxation of blood vessels, In combination, if you run your blood pressure low anyway, or if you're on other medications that can also lower blood pressure, that's where you might not tolerate medications or supplements like L-Arginine, because you might be running your blood pressure actually too low. When it comes to nutrient sources, these are the ones listed here, similar to the others: fish, soy, chicken, whole grains, and beans. And the misconception that soy products like tofu can cause high estrogen levels and low testosterone in men is not true. So feel free to put some tofu in an air fryer and eat as much of that as you want. When it comes to L-Arginine supplementation, it's again available in powder and capsule form. And in those with erectile dysfunction, actually research suggests that combination therapy with something like a daily L-Arginine and a daily tadalafil, also known as Cialis, can improve erectile function more than either one of those alone. Now, what we do know from this research as well is that people may have more side effects when you combine these medications, side effects that are common with Cialis, like facial flushing, headache, vision changes, sinus congestion, and heartburn and muscle aches. So that might be a reason why you stop either the Cialis or the L-Arginine if you have some of those bothersome side effects. But like D-Aspartic acid, overall, research suggests that L-Arginine is safe and generally well tolerated. So that's the end of our presentation. We spoke about a lot of vitamins and minerals. Vitamins and minerals are critical to how we function on a daily basis. Even things like fatigue and brain fog. You know, you don't have to have a diagnosis of high blood pressure or heart disease to warrant the benefits of anything that we spoke about today. And really everything we spoke about is going to help people get to the next level when it comes to daily functioning and optimizing one's health. Aaron, is there anything else that you would like to add to today's session?
Absolutely. So I think it's important for us to realize, maybe it doesn't sound the most sexy when we talk about our vitamins and our minerals, but correcting those deficiencies is the first line approach for us to being able to look at how else can we treat our chronic conditions. Without correcting those conditions, we might be missing a lot of different things. We might be using other treatments to correct something that could have been fixed with a simple supplement or a diet modification. So I want everyone to consider when they're thinking about their supplements and they're thinking about their nutrition, how is this going to impact my overall health? And over time, how will this affect the chronic conditions that I have? And when we're making our decisions when it comes to nutrition or making our decision when it comes to supplements, let's find a high quality diet and a high quality supplement while we're learning on those diet strategies in the meantime, so that we can have a strong micronutrient reserve so that our conditions can be managed maybe from a nutritional standpoint.
Awesome. And the other point that you had made is that some of the medications that we might be on that are very important for us, we may stop them or not be able to tolerate them because of some of the side effects, but some of those side effects can be treated with appropriate supplementation. What's an example of one of those? Was it statins that you had mentioned?
Yeah, I think statins is the most popular one that we see because so many people are on statin medications and so many people experience muscle soreness. And what that is actually being caused from is a deficiency of coenzyme Q10, used to regulate our overall cell health in our body, in our muscles, and and a deficiency of that leads to muscle soreness, which is the number one reason why people stop taking their statin medication, which statin medications are very important for our cardiovascular health. And so if we just, have that conversation with our practitioner, hey, I'm having muscle soreness and it's making me want to stop my statin. We can look at nutrient changes and we can look at supplements with coenzyme Q10 so that side effect can eventually go away and so that we can maintain you on that statin medication. And hopefully that medication will extend your life and make you a healthier individual.
Awesome. So many, just so much great information that you spoke about today that nobody ever really gets taught, other than perhaps pharmacists who go to school for 4 years to learn all this nuanced information, but every supplement is not the same. And so I think one of the other messages is if you want to talk about supplements, find someone who will sit down and talk to you about them. So not every pharmacist is the same. Not every healthcare provider is the same. So find one that will sit down and go through these different products and tell you which ones might work well for you. And if it doesn't, which other products might work well. So find an advocate, find a good pharmacist, a good healthcare provider who can work you through this. And as Aaron, also mentioned, these products are not available just like at any convenience store. And so you're going to need a good healthcare provider to actually get products that are from, let's say, orthomolecular. You can't just buy those products. So you're going to have to find someone who can get those products for you.
That's absolutely right. Yes. And that person should remain in contact with you during the process that you're taking those supplements, so they can make sure that you're getting the desired result out of it. And if not, we can continue to make modifications until we are receiving that desired result.
Awesome, folks. So stay tuned for more videos coming at you from Aaron and Amy.
Absolutely.